About 1 in 9 men will be diagnosed with prostate cancer, but the odds increase to 1 in 6 if they're African American. Prostate cancer is also the second leading cause of cancer-related death among men, and there are often no symptoms. Luckily, the 5-year survival rate is nearly 100% for people who detect and treat the disease early. We are raising awareness and have a doctor in studio to take your calls and answer your questions tonight on Toyota Sports Talk.
Live from News Channel 8, this is Toyota Sports Talk.
Hey everyone, welcome to Toyota Sports Talk. I'm Erin Hawksworth. Thank you so much for joining us. The prostate cancer death rate is expected to go up by 3,000 men this year. And February is Cancer Prevention Month, and we are lucky to have Dr. Nilay Gandhi from Potomac Urology and Shawn Supers of ZERO Cancer in studio tonight. Thank you so much for joining us. You guys are back in studio with us because we had such a great response from everyone at home calling in with their questions the last time you were on. So we thought we should do this again. So first, Shawn, let's start with you. Tell us a little bit about ZERO and the mission that you guys have.
Yeah, sure. Yeah, thanks for having us on again.
Yeah.
I really appreciate it. It is very alarming to us that we're expecting the death rate to climb by 10% this year. Simply unacceptable statistics. And ZERO, the End of Prostate Cancer, is a national nonprofit organization that's based in Old Town Alexandria. We were formed in 1996, and our mission is right there in our name. It's simply to end prostate cancer. We'd like to achieve Generation Zero, which is a whole generation of men free from the disease.
Awesome. And Dr. Gandhi, how did you get involved?
So as a urologist, we see a lot of prostate cancer. We diagnose men early, and we also operate for prostate cancer. And so we were looking for ways to involve our practice, our patients in the community, and we happened, as Shawn said, you know, ZERO is located in Alexandria, Virginia, where one of our practices is located. So it was kind of a match made in heaven that we were able to partner together in these race series that have been going on.
Now we were just talking about raising awareness. What are some things, key things that you want to tell some of the men and even spouses out there, you know, to help out? Yeah,
absolutely. So, I mean, prostate cancer typically has no symptoms. This is one of those things where men can have, you know, feel great and they wonder, well, why should I go see the doctor? But that's where, again, you know, early detection, just routine health maintenance, just like you would take your car in to get checked, make sure everything's okay. That's very similar to prostate cancer. You can develop symptoms where you have urinary issues, but a lot of times that's late in the disease or could mean something entirely different, like an enlarged prostate.
And we have some of the numbers up here. Shawn, tell us about some of the staggering statistics.
Well, we'll lose 80 men to the disease just today. And what is so upsetting to me about that is that if the disease is caught early in its early stages, it's nearly 100% treatable. So we don't need to be losing any men to this disease. And frankly, there are some great screening methods that men can do and talk to their doctors about, particularly the PSA blood test. PSA stands for prostate-specific antigen, and while it's not a 100% foolproof test, it is a great diagnostic test where you want to establish your baseline at a certain age, depending on your race and your family history, things like that, maybe, you know, 40, 50 years old, somewhere in there, generally speaking. You want to at least find out what your base PSA level is. And then if there's an increase in that, that could be an indicator that you have prostate cancer. Then you're going to want to talk to somebody like Dr. Gandhi at Potomac Urology about what your next steps are and what your treatment options may be should you have prostate cancer.
Okay. I want to point out that we are taking your calls. We want to use this as an opportunity to give back to the community. We have Dr. Gandhi and Shawn Supers here to answer your questions. But before we get to that in a second, we have Bert Watson, MMA coach, on the line. And Bert, you are a survivor. Tell us a little bit about your story.
Absolutely. Well, first of all, I truly appreciate the opportunity to be on your show, Erin, and to actually get a platform to express my thoughts and my opinions. And you know, it's one of those things where I'm beginning to learn about the disease and about early detection, you know, and how it can be caught early. And you know, one of the things that I can say about that is that it's never too early to be caught. You know, it's never too late to get tested. 2.5 years ago, I left the UFC. I was with the UFC for 14 years, and I worked with nothing but athletes and men and young men who have brothers and fathers and nephews, you know, and older adults in their life, such as myself. And when I left about 2.5 years ago, just for the sake of going to get that old man test that everyone should get a physical, I went and I had that done, and I was cleared. There was absolutely nothing there. So, I was good. And during that time, I had my PSA blood test. I had that level, and I had that check, and there was nothing. A year and a half later, and for the life of me, you know, I heard the doctor and Shawn saying that there are no symptoms. I really had no symptoms. I just figured, I always had belief, you take care of your body and your mind, and it'll take care of you. Mm-hmm. So with that in mind, and, you know, I'm 69 and running with those young studs, I'm always conscious of being in shape and taking care of myself. So a year and a half later, I decided to go back to get a physical and get tested, and I did that. And I went back and, you know, I had my blood work done, and I got a call from the doctor to come in, and he wanted to talk. I came back a couple of weeks later, and he said my PSA had shot up to about close to 6. And at that point, he said we needed to do a biopsy. Well, I've heard of biopsy, and I knew what it was, kind of a little bit, but never experienced it. So I went and I did that. Came back maybe about 3 weeks later, and the doctor said to me, we talked, and he said, well, Bert, he said, the good news is that you came in and you got tested early and we caught it, and, you know, not the bad news, but unfortunately your choices are surgery, chemo, or radiation. And not even realizing I'm saying, choices for what? You know, it's just, that's kind of the way it hit me. And he said to me, those are my choices, and that was only a year and a half later. So detection and getting caught early, you know, it just told me that the safest thing to do is to get tested and to keep getting tested. It's just a matter of a blood test, having your PSA level checked, having it tested, and, you know, going to the doctor and going to the hospital is something I know that men don't like to do. Yeah. And athletes, they do it because they work with their bodies, you know. But, you know, actually, and as I said before, working in MMA, I worked in boxing, and athletes go to the doctor and go and get their body checked. But sometimes, for the most part, when they go get checked and tested, it's for other areas. You know, it's some kind of muscular, you know, or joint, or to make sure that their legs or their ankles, you know, or they get an eye test, you know, or something like that. Or very seldom is it the kind of test that you get tested for your PSA level or anything. Mm-hmm. So even as athletes, you know, I want to make sure that I get a message across and make everybody aware that the best prevention is to go and get tested.
Awesome.
You've got to get tested.
Bert Watson, thank you so much for sharing your story, because it is powerful, and just by sharing it and having people at home listen to that, hopefully they will be enticed to go get tested. Thank you so much. We're going to take a break. The phone lines are flooded. We are excited to take your calls. We have Dr. Gandhi and Shawn Supers with ZERO. We're talking prostate cancer awareness, 703-387-1020. We are back with your phone calls, your questions right after this.
Help me spread prostate cancer awareness.
Count me in to raise awareness for prostate cancer.
We stress early detection. We're here as a team, and we're here to help men survive prostate cancer.
Hi, we're Innova. Count us in. We are the Andrew Jackson Masons. Count us in.
Count me in.
definitely count me in to promote awareness of prostate cancer.
That was awesome. That was from the Zero Prostate Cancer Run Walk last year, and I will be involved again this year. Tell us a little bit about that event.
Yeah, well, we're excited. It'll be our 11th annual race. We've moved it to Saturday of Father's Day weekend because we want the dads to be able to enjoy their day on Sunday, but this has become a DC Father's Day tradition for us. So it'll be Saturday, June 16th at Pentagon Row in Arlington, Virginia. Erin's going to be our MC for the day, so we're excited about that, and we'd love for everybody to come out and join us.
It was such an amazing event last year. I'm really excited to be a part of it.
Absolutely.
Second
it's
time
very
around.
family friendly, isn't it?
It is. It was
Yes.
a great way to spend Father's Day, and I'm glad you are doing it on Saturday because I think there'll be even more people because everyone who already had the Father's Day plans will be able to. There's no excuses this time around.
No excuses.
All right. Well, speaking of no excuses, we've got to get to the phone lines. Let's go to Linda in Woodbridge. What's up, Linda? What is your question?
Hi, so my question's in twofold. Dr. Gandhi, I watched you last time you were on, and I want to get my husband in there to see you. So how can I get in contact with you? Maybe a phone number or a website so I can get an appointment? And then my question is, my husband's up 3 to 4 times a night having to go to the bathroom. Is this something he should be worried about? Do you think it's related to prostate cancer?
So with the urination complaints, that again, if it's late stage prostate cancer, you can have symptoms like that. Most of the time that could be indicative of an enlarged prostate that, as men get older, their prostates get bigger, and that can cause issues with urination, whether you have to wake up at night many times, whether you have to, run to the bathroom urgently, or you may even have a weak stream. So a lot of times that's what we try to assess when men come in as part of a prostate screening, which would involve for an enlarged prostate as well as for cancer. As for coming to see us, we have 2 office locations in Alexandria, Virginia and Woodbridge, Virginia. And you can definitely contact us. Our phone number is 703-680-2111.
Awesome. And I think Linda is in Woodbridge, so that works out great.
Perfect.
That's a great call. Thank you, Linda. Let's go to Charles in Clinton next. What's up, Charles?
Hi, good evening. I'm Charles. I was diagnosed with cancer back in 2014. And initially, at the age of 51, because I heard from Howard University Medical Center that, when you get at that age, you should go ahead and get your prostate checked out. So at Howard University, I had my initial biopsy. I went in there and had my biopsy. As a result of my biopsy, the symptoms that I was experiencing were, like the last caller said, that I had frequent urination periods over the night. What was happening is that my prostate was swelling to the point where it would, once it swells, it shuts off the urinary tract where you can't even, it gets so bad that you can't even urinate anymore. So after my biopsy, I experienced some complications, which was treated at another hospital. But eventually I went to the Washington Hospital Center in the District of Columbia, where Dr. Hawang treated me for prostate cancer. It was like in and out surgery. It was easy. It wasn't, painful. My question to the doctor is, now that what they did, they removed my prostate because I caught it early. But my problem is when they removed my prostate, my thing is that I'll never be able to have kids again, and I'll be having trouble trying to, and I don't like to take pills to, to satisfy my wife. So at the same time, I was saying like, whoever interested in getting treatment, it's okay to go for the treatment because at least you'll live a lot longer than you would if you didn't do anything at all.
Yeah, and I'm glad Charles brought that up because that is probably a reason why a lot of men are scared to go get tested because of the fear of, some of that, what could happen.
Right. So, I mean, with any prostate cancer treatment, like Charles mentioned, number one priority is cancer control. We always want to make sure that, you're alive. So we want to give you the best chance at cancer control. But there are some subsequent side effects that may occur with any sort of treatment, whether it's radiation or surgery, and you can have issues with urination where you have incontinence, you leak urine, or you can have issues with erections where you're unable to obtain an erection for sex. And so those are very real conversations that we have every day with these men. And we also assist in how to improve those functions afterwards, where it's not a matter of it'll never happen again. This is where you are, that we always work with everyone to maintain a quality of life that they're happy with.
Awesome. All right. On that note, we're going to take a break. We want to take more of your calls. 703-387-1020 is the number to call. We've already heard from several people who have shared their story. We want to hear from you. We're back right after this. Hey, welcome back to Toyota Sports Talk. All right, we have so many more callers. We're going to go to Beverly in D.C. next. Hey, Beverly, what is your question for Dr. Gandhi?
Yes, I'm calling. I was wondering, and it appears very much so. Can you hear me?
Yeah, there seems like some loud noise with the phone, though.
Okay, it appears that it seems that this thing that men have, just as the women have, the cancer. It appears that every time they go to get checked to see if they have something wrong, then that they get it, regardless of whether or not they have it. And I know that it appears that way, very much so. Just like the young man said, there was nothing wrong with him after he got the test. Then something happens.
Okay.
I know many people who have had that experience.
All right.
So I think, a lot of times guys won't have any symptoms for prostate cancer. So when they do get checked, they feel great. And it's mainly based off of an exam or a blood test. And there are subsequent things after someone has a PSA that is abnormal or an exam that's abnormal. There are certain things that need to be done to get a diagnosis, such as a prostate biopsy. And I believe that's what Charles was referencing. He was having some issues after a biopsy, which can occur. And so there are always, potential risks associated with any procedures, whether it's a biopsy or whether it's a certain treatment. But I think the ultimate goal is still trying to identify men who are at risk for cancer and have that potential to save their lives, because I think the risks of the side effects are actually lower when you look at the overall population who have been treated.
So if your PSA is abnormal, what can you say to folks who may be dealing with something like that?
Yeah, absolutely. And so like Shawn had mentioned, PSA stands for prostate specific antigen. So it's not prostate cancer specific. So it is a screening. It's a red flag that we need to look at this further. And so usually the next step after you repeat blood work is to perform a biopsy. And that's a procedure in the office where we obtain some tissue from the prostate to truly see, is this related to cancer or not? And there's a lot of newer technologies that we tend to utilize, that I utilize, where we use an MRI to actually target a biopsy to try and give a very accurate reading in terms of, is this related to cancer or not?
Okay, all right. We're gonna take a break. Final thoughts when we come back. Welcome back. We only have about 2 minutes left in show, so I want to go to Abdullah in Woodbridge. You're on the line. What's your question?
My question is, doctor, that can stress cause cancer? It's a quick question.
That's a good one.
What was that?
Can stress cause cancer?
So a lot of times, there are lifestyle changes, lifestyle factors that can affect not just prostate cancer, but cancer in general. So a lot of times stress, healthy diet, healthy living, exercise, diet, all play a big role in cancer prevention. So I think it's not only just genetics, family history, anything along those lines. There are other environmental factors that do play a role.
All
Absolutely.
Right. So if people have more questions or they want to get involved in the run walk this year, where should they go?
So everything is on our website, zerocancer.org. You'll find on there educational resources, our 0360 patient support program for men who are battling prostate cancer currently. and information about our race. We'd love to have everybody come out and join us. And as Dr. Gandhi just said, being active and staying physically fit is a great way to fend off and prevent cancer. And February is Cancer Prevention Month. So what better time than to sign up to join us on June 16th for our run walk. You can go to zeroprostatecancerrun.org/DC to register. Registration is open now.
Perfect.
Yeah.
All three of us will be there. The info's right there on your screen. We appreciate everyone who called in and shared their story, asked some questions. Special thank you to Bert Watson. We really appreciate it. Dr. Gandhi, Shawn Supers, thank you so much.
Oh, thank you.